Hi again. In this lecture, we'll talk about tongue muscles, soft palate muscles, and pharyngeal muscles. Let me bring up the course objectives that we've been looking at. So, there are the tongue muscles we'll talk about, and then we'll go to the soft palate, and then we'll do the pharyngeal muscles. So some notes, pay attention to these when we're talking about the tongue muscles. Origins can be derived from their names again. All of these tongue muscles are innervated by cranial nerve 12, the hypoglossal nerve. So we're going to divide those up, and these are the tongue muscles, into intrinsic tongue muscles and extrinsic tongue muscles. And so I put a note in here that you need to be very clear on your definition, your understanding of intrinsic versus extrinsic. And this came up in A and P when you were dealing with, for example, the intrinsic and extrinsic muscles of the eye. And we talked about intrinsic and extrinsic muscles of the hand. As you know, many of the flexors and extensors in the hand, the origin of those muscles is up on the humerus. So the belly is in the forearm. So those are extrinsic muscles of the hand. The belly is outside the hand, origin is somewhere outside. Intrinsic muscles of the hand, both the origin and insertion are within the hand. Same with the eye, same with the tongue. So if we have intrinsic muscles, the definition is that both the origin and the insertion are intrinsic to the tongue, inside the tongue. Extrinsic muscles of the tongue, it's the origin that's outside the tongue. The insertion of all of these is in the tongue. The difference is where is the origin. Okay, so with that said, let's jump into the slides. And here is the basically what I just went over. I copied this straight out of the objectives and pasted it into a slide. So these are the intrinsic muscles, or excuse me, the extrinsic muscles. Let's start with those first. So where do you think the origin is with a stylo or a genio or a hyo? The insertion is all in the tongue, of course. So those are the insertions, stating the obvious, and these are the origins. And I'll just help you to identify the muscles. And then we'll look at the intrinsic. Not a lot to say. Fibers are just running in different directions inside the tongue. Okay, next slide. And here are those three extrinsic muscles of the tongue that we went through. So let's just consider these one at a time. Let's start with the genioglossus. So the genial tubercles are up in this region. They're little spines, remember, on the medial aspect of the mandible. And all of this fan-shaped muscle is the genioglossus. Runs to the tongue. And you can think about the action of that those muscles will exhibit on, produce on the tongue when they contract. Keeping in mind that the origin is stationary, the insertion is what moves. So we'll come back to that. The styloglossus, running from the styloid process of the temporal bone down into the tongue. So here is the styloglossus. And put a little note in here just as review, just for a reminder, the stylohyoid muscle, also attaching to the styloid process. But back to the third tongue muscle, the hyoglossus, originating on the hyoid bone and then fanning up into the tongue. Okay? So those three are extrinsic muscles of the tongue. So you ought to be able to blank out labels, take a similar image, and identify those. The styloglossus might be a little bit confusing just due to all of the activity around the styloid process. So you need to be careful on those. We're also going to come back to another muscle later, the Stylopharyngeus muscle, which is just sort of hinted at here. Hard to see. Don't panic about this yet. Just focus on these three extrinsic muscles at the moment. And then the intrinsic muscles of the tongue. So both the origin and the insertion are inside the tongue, and they just the muscle fibers run in different directions. So there is a longitudinal set of muscles that run lengthwise, one group on top, which is the superior, another group, which is inferior, and they also run lengthwise. And then we have the vertical muscle fibers that sort of run vertically. And then we also have the transverse fibers that run side to side throughout the tongue. That's about it. They're running basically in all three directions of the tongue. Produce different movements. And then again, here are the extrinsics. We haven't yet discussed the palatoglossus. That's usually lumped in with soft palate muscles, which is where we'll consider it again. But there are the three that we went over. I will not ask you to identify these muscles in this view. I just don't think you have enough context to do that. But they're just shown there to remind you that they are extrinsic muscles, but don't worry about identifying these in this picture. That would be difficult. Let's move on. And here is a review slide. It's a little bit fuzzy for the image. The boxes are okay. And I've tried to put in the muscles that we just went through. So here are some of the intrinsic muscles again. You recognize those. And some of these muscles we've already gone over. All of these are muscles in the blue box. So there's the thyrohyoid. We talked about that as an infrahyoid muscle. We have the geniohyoid, and then we have the genioglossus, which is one of our tongue muscles that we're considering. The hyoglossus is another tongue muscle that we just looked at, and the styloglossus. And the arrows are indicating direction of tongue movement. And so you just kind of follow along with the arrow. And for example, the genioglossus, originating on the genial tubercles, fibers fanning out into the tongue. When those muscles contract, the tongue moves anteriorly and you protrude the tongue. You stick the tongue out as those muscles contract. Conversely, the styloglossus, these fibers are running more or less posteriorly. And when those fibers contract, it pulls the tongue more or less in that direction. So retraction. And just looking at the direction of the muscle fibers for the hyoglossus, if the hyoid bone stays stationary, doesn't move, and you contract these muscle fibers, the tongue is going to be depressed. and pulled slightly posteriorly. So that's all this figure is kind of showing. Okay? So if you have a good view of the muscle fibers and you just kind of imagine what's going to move when those fibers get shorter, it helps you determine the function. And there's the Genioglossus nerve. Let me back up a moment. Okay. That's a typo. I left out the P. So fix that in your notes. The hypoglossus or the hypoglossal. Hypoglossal and hypoglossal nerve. Okay, this one. Okay, next slide. Moving on to some pharyngeal muscles, so muscles of the pharynx. And let's go, these are a little bit out of order with the objective sheet, so let me go back to the objective sheet. It's not a big deal, I don't think. Here is our objective sheet. So we went through the tongue muscles, intrinsic and extrinsic, and we're now considering the pharyngeal muscles. So there's a Stylopharyngeus, and then you have these three constrictors, the superior, middle, and inferior pharyngeal constrictor. I don't care about the innervation of these muscles, so I put the pharyngeal plexus. The point is that they're not cranial nerves. And then the Stylopharyngeus is a cranial nerve from the glossopharyngeal. Again, any nerve questions would be extra credit, and I'm not likely to ask you nerve questions on these muscles. I think there are other things to pay attention with, or pay attention to with the nervous system. So on these pharyngeal muscles, I would like you to read about their origins and insertions rather quickly and their basic action. So you should be able to basically tell me what the pharyngeal constrictors do. Food or water has been pushed to the back of the oral cavity. It's been pushed through those fascial folds. It's back into the oropharynx, and then the soft palate is going to close off the nasal cavity. We're going to block off going back into the oral cavity, and then those constrictor muscles are going to compress and force the food down into the esophagus and propel it into the smooth muscle of the esophagus to keep it moving toward the stomach. Okay, so back to the slides. There's another slide coming up that shows this in a perhaps a little simpler color scheme. But here is our superior pharyngeal constrictor. It wraps around both sides, and this was our pterygomandibular raphe. From the pterygoid process down to the mandible, soft tissue, and then you recognize the muscle anteriorly from that. It's been cut, of course. So if you get those landmarks, you should recognize this again as the buccinator muscle. Okay, well, at any rate, there's the superior pharyngeal constrictor. There's a middle pharyngeal constrictor that does the same sort of thing, loops around, and then you have an inferior pharyngeal constrictor set. And they sort of contract in unison, or in sequence rather, and propel the food down into the esophagus. Sort of peristaltic motion. Okay, the Stylopharyngeus, let me clean up this a little bit. So the Stylopharyngeus is running from the styloid process again down into the pharynx. It's very difficult to see in this view, but there is a Stylopharyngeus muscle. Okay, so again, for practice, you should be able to start identifying these, and I'm drawing little dots on. Okay, those are pretty easy. Don't miss the obvious one here. The lower bottom right. That muscular tube is the esophagus. Okay, that's probably enough of that slide. Here's the colored one I was referring to for the pharyngeal constrictor muscles. So we have the superior, and then the middle, and then the inferior pharyngeal constrictor. And this is a better view, it's a little more clear, of the Stylopharyngeus. Again, running from the styloid process down into the pharynx in yellow, which is the Stylopharyngeus. Okay? And again, you should be able to recognize these, and I'm drawing circles on. They're pretty obvious. They're pretty straightforward. The red and the red are the same muscle. And then you have this one is pretty easy to identify. Okay, next slide. Soft palate muscles have the Palatopharyngeus and the Palatoglossus. And these also form the fascial pillars in the back of the oral cavity. I believe that those are talked about in your course where you discuss the oral cavity. So again, the name tells you where they are running from. The Palatopharyngeus is running from the palate, the soft palate, so we're off of the hard palate. You know, if we're looking at the bone, the hard palate is running, you know, there's the bone, that sort of thing. So we're back off of that posteriorly onto the soft palate tissue. So the Palatopharyngeus and the Palatoglossus. And the Palatoglossus, soft tissue at both ends. When that muscle contracts, it pinches the soft palate to the tongue and helps to close off the oral cavity during swelling. You can read about that basic function in the textbook. And similarly with the Palatopharyngeus, compressing the soft palate with the superior portions of the pharynx, closing off the oral cavity once you swallowed food. So then when the superior constrictor muscles start to contract, it does not push the food back into the oral cavity. It's blocked off, and the food then has to descend down into the esophagus. It also doesn't push the food back up into the nasal cavity. So you have to close off the nasal and oral cavities during swallowing. So again, read about that briefly in the textbook. And here is an oral view, of course, and the fascial pillars. Here is the Palatoglossus, forming the anterior fascial pillar. Soft palate. And then we have the Palatopharyngeas, which is descending deeper into the pharynx. I'll just use a little darker yellow. And the palatine tonsils are right in between, so it's sort of a landmark. And I'll probably just erase all of this so that you can see it in a better view. Although your slides are uncorrupted with this drawing. Let's go ahead and erase it anyway, I guess. Okay. And then there are some muscles in the blue boxes to just sort of check yourself with. Can you get oriented on this pterygomandibular raphe? Do you recognize it? If you do, there's a muscle anterior to it, which is the buccinator. Posterior was a superior pharyngeal constrictor that sort of wraps around posteriorly to the other side. Okay? Next slide. Uh-oh. Oh, shoot. It just crashed. Hang on a second. Maybe drag it back up quick. Where were we? Oops. Okay, let's try this again. Next slide. Okay, soft palate muscles again. This is a rather confusing view. It's a posterior view from the back, looking forward. It's a little bit difficult, but at any rate, here is a superior pharyngeal constrictor. It's been cut on both sides. These are soft palate muscles. We had the Palatopharyngeus that we just discussed, running from the soft palate here, going down into the pharynx. So it's going to be depressing the soft palate and bringing it closer to the soft tissues of the pharynx. And then there are two villi palatini muscles. So villi is for villus, our little thin covering like a membrane on the palate, and one tenses it and one elevates it. So we're trying to close off the nasal cavity when swallowing, the nasal and oral cavities. They're difficult to appreciate. If you recognize the name of them and their basic location and their basic function, I think we're okay. So don't hook it up to the hyoid bone. Don't hook it up to the tongue. It's going to the soft palate, the palatini, referring to palate, and villi is for a veil or a thin covering on the soft palate. It tenses it, helps to close off the oral and nasal cavities during swelling, and I think that's good enough. I will not ask you to identify the tendon of the tensor villi palatini, but it's a little bit interesting. Here is the pterygoid plate, and we're looking at the medial pterygoid. And then the muscle is descending laterally to that, and then the tendon sort of hooks around underneath that hamulus and then inserts on the soft palate. helps to tense it when it swallows. Enough of that. Enough of the tensor and levator villi palatini. And a note to study the figures. This is for the muscles in general in chapter 4, which is muscles. And do those practice review questions and muscle identification problems at the end of the chapter, and it should help. So this is pretty much it for the muscles. So you know what you have to learn, which is primarily what's on the objective sheets that's posted on Canvas. You'd be able to recognize these muscles and understand the detail on the objective sheet. We have several Zoom meetings to go over this before the exam. I think there's plenty of time. So I don't think you'll have problems with this if you spend the time looking at this material and studying it. So hope to have questions and discuss details during Zoom class time. We'll see you then. Bye.